Hi, my name is Jessica, and I'm in the med room preparing to prepare medication for Mildred Campbell. And first, I will do hand hygiene. I will do my first check right now. Furosemide 40 milligram PO, metoprolol 50 milligram PO also. And I will do my second check when I pull out the medication against the EMR. Furosemide 40 milligram PO. Expiration date is November 2024. Okay. And second medication, metoprolol 50 milligram PO. Expiration date 12/20/25. For these two medication, I will assess for blood pressure and apical pulse before giving it to them. For metoprolol, I will hold the medication if its blood pressure is less than 110. For furosemide, the dosage is 20 to 40 milligram PO twice a day, and it's a diuretic, so it inhibits sodium and chloride reabsorption, making the patient pee more often. So I would give the patient the medication in the morning to prevent peeing a lot at night. And the adverse effects of furosemide is orthostatic hypertension, blurred vision, peeing a lot at night, electrolyte imbalance, and some nursing consideration for furosemide is it can cause tinnitus, and I would monitor for blood pressure, their weight, and their pulse frequently. I would also monitor their fluid intake and output. I will also monitor their electrolyte levels, like their potassium level, glucose, magnesium level. I will assess for signs and symptoms of hypokalemia, which is low potassium level, manifested by muscle weakness and cramps. And for metoprolol, the dosage is 25 to 100 milligram daily. And some metoprolol is a selective beta blocker, so it selectively blocks beta 1 receptors, which decrease the cardiac output and decreasing hypertension, managing hypertension. And the adverse effects of metoprolol is hypotension, slow heart rate, which is bradycardia, and edema, and mental confusion. So some nursing consideration for metoprolol is I would also monitor their blood pressure, pulse, and EKG routinely, and their electrolytes level. I will also assess for signs and symptoms of heart failure, and most importantly, I would tell the patient not to suddenly stop the medication, because suddenly discontinuation of the medication can exacerbate angina or myocardial fracture. Before I go to the patient room, I will sign out of the EMR and lock the medication system. And now I'm ready to go. I'm at the patient's room and I'm performing hand hygiene. Hi, my name is Jessica and I'm the student nurse of City College of San Francisco. Today I will be giving you your hypertension medication. Can you give me your name?
Mildred Campbell.
And your birth date?
August 1st. 1955.
Do you have any allergies?
No.
Okay. And I will do my dirt check right at the patient's bedside. I will not open it until I'm at the patient's bedside. Furosemide 40 milligram, 11, 20, 24. And metoprolol 15 milligram, 12, 20, 25. And I have to get your blood pressure and your heart rate. Okay, 120 over 80. I would also need your heart rate. Right, don't tell you. Okay, 60 beats per minute. Medication is for your hypertension. It will make you pee a lot and decrease your cardiac output. Would you like some water with it?
Yes.
Okay. Here's your medication. I will not leave the patient bedside until I see patient finish their medication. I will come back in an hour to assess your blood pressure again. Okay? Thank you. After I leave the patient's room, I will do documentation in the EMR. I will document the medication that was given and the time and also the route. I will also document the patient's response to the medication administration. So patient was compliant with taking the medication, and I will go back and assess the patient an hour later to see if the medication was effective. Hi, I'm back to check on you to see how you're doing. Can you give me your name
Mildred Campbell.
and your birth date?
August 1st, 1955.
Okay. I just have to check your blood pressure real quick. Okay, it's within the normal parameter. So the call light will be here if you need anything. Okay, thank you. After I reassess the patient, I also have to go back to the patient's chart to document that whether or not the treatment was effective.